Major depression is a highly prevalent neurological disorder affecting nearly 21% of the world population. Currently, the available treatments, such as synthetic drugs, present adverse side effects, and the associated antidepressant mechanisms are not well clarified, posing challenges in the treatment of the disease. There is a clinical need for safe and effective pharmacotherapeutics, such as herbal medicines, which are known to be of greater compliance and equipped with milder side effects. Polygonum cuspidatum is an example, being a traditional herbal medicine used widely in Asia for the treatment of neuropsychiatric disorders. Trans-resveratrol is the active ingredient of Polygonum cuspidatum, abundant in the skin of red grapes and red wine. Despite these effects, there is limited information on its antidepressant effects. Major depression is associated with the changes and dysfunction of the monoamine system, in particular to the deficiency of serotonin, 5-HT, and noradrenaline. Though the underlying mechanism of depression and the modulatory systems have not been adequately resolved. Current antidepressants work by increasing the levels of monoamines, 5-HT and NA, and inhibiting monoamine oxidases, MAO. Monoamine neurotransmitters are inactivated by MAO enzymes, altering the neurotransmitter's function. Trans-resveratrol inhibits MAO activity in glial cells commonly found in depression. There is an interaction between chronic stress and depression due to deficiencies in 5-HT and NA. 5-HT is involved in the activation and feedback of the hypothalamic pituitary adrenal HPA axis. A reduction in 5-HT function from chronic stress can induce behavioral abnormalities exhibited in patients with major depression. Trans-resveratrol increases 5-HT levels in the frontal cortex, hippocampus, and hypothalamus. As observed in rat models, trans-resveratrol can reverse reduction in 5-HT levels, an effect on the monoamine metabolism induced by stressors. Additionally, trans-resveratrol can reverse the reduction in NA levels in the frontal cortex, striatum, and hypothalamus. There have been limited studies on the establishment of trans-resveratrol's mechanism of action to alleviate depression. However, the antidepressant-like effects have assisted in understanding its mechanism. The antidepressant drugs we're going to be looking at today is tricyclics and tetracyclics, antidepressants, selective serotonin reuptake inhibitors, monoamine oxidase inhibitors, and dual serotonin and norepinephrine reuptake inhibitors. Looking at tricyclics and tetracyclic antidepressants, we see that 5 or more drugs are included in one. Main mechanism of action is serotonin and norepinephrine reuptake inhibition to increase availability. You can observe there are adverse side effects involved with this drug. Selective serotonin reuptake inhibitors. This drug works by selectively inhibiting serotonin in the serotonergic neurons. We have an increase in serotonin and a delayed distribution of 5-HT neurotransmission. Listed before you are the adverse side effects. Monoamine oxidase inhibitors. These drugs work to block the metabolism of monoamine transmitters, norepinephrine, dopamine, and 5-HT to increase their availability similar to other drugs. Present are a unique group of adverse side effects. Dual serotonin and norepinephrine reuptake inhibitors. This drug is dose-dependent. It has a similar mechanism to an SSRI at low doses. We can achieve norepinephrine reuptake inhibition or dopamine reuptake inhibition depending on the dose. Presented are the adverse side effects. Trans-resveratrol. We saw earlier that it inhibits MAO activity and increases 5-HT and NA levels in specific brain areas. In a similar manner to the other antidepressant drugs, trans-resveratrol stands out in having no observed side effects as of April 2013. The antidepressants mentioned all produce efficacious effects through different mechanisms involving the main neurotransmitters of the monoamine system. However, they are all equipped with varying side effects compared to trans-resveratrol, which presents none at the current moment. I bet you're wondering, do human clinical trials support its antidepressant effects? As of October 2013, there have been no record of human clinical trials, but various behavioral studies involving rat models have supported trans-resveratrol's antidepressant effects, exhibiting much promise for the drug in future trials.